Next, we'll hear from the state of New York. The program is America Works, and it will be presented by Brian Wing and Lee Bowes.
Thank you. We're in the home stretch now.
We are. You've waited a long time.
Yes, but it's certainly worth it. The creative partnership forged between the state of New York and the for-profit business America Works was something new and very different for us, something that has proven its effectiveness, and something that I believe can and should be replicated by others, particularly as we begin operating in a reformed and quite different welfare environment. America Works was new for us because traditionally we contracted with only not-for-profit organizations. Our contract with America Works was also new and different in another key aspect. It was performance-based. That is, the corporation receives full payment only if the client is placed in a job and is still working after 90 days. Traditionally, employment and training contractors submitted their budgets to us and were paid without primary regard to results. Government paid the same amount if people got jobs or if they didn't, if they stayed in the job or left it after 1 week or even 2. Today, there's a new urgency for states to insist upon results and performance in getting people to work. There will be a challenge of time limits, and there will certainly be challenges to our budgets. We have to get results, and we have to use whatever resources are available and most effective, be they public, for-profit, not-for-profit. In this instance, getting people to work in the pilot areas of New York City and the Capital District, the for-profit, performance-based America Works approach has proven much more effective than our traditional approaches. It's not just a matter of placing people in jobs. It's also a question of helping them to keep those jobs. My department tracks retention of America Works placements. Now, basically, these are individuals with an average of almost 5 years on welfare whom America Works has placed in full-time jobs with health insurance and other benefits and an average starting salary of $16,000 a year. The results are very impressive. After more than a year, 80% of the clients placed have remained off welfare in New York City, and 94% in our second pilot in Albany County. As many of you know, the record of job retention is generally not good for former welfare clients. A lot of clients on welfare get jobs, but a lot of former clients have trouble holding on to those jobs. America Works recognizes this and addresses it through a unique follow-up support system, which is more extensive than any I've seen around the country. A corporate representative goes to the work site for the first few months, providing the supportive services necessary to assist the clients to retain employment. Representatives help with employer-employee issues, such as time and attendance, interaction with supervisors and coworkers, and evaluation of job performance. There's also off-site support for problems with housing, childcare, and any other issues the client may have. We believe this careful follow-up is the key to effective retention. Based on the experience that we've had with America Works, the performance-based, results-oriented model is now the norm for us in all of our employment contracts. It is now 2.5 years since we began this approach, and during this time, job entries have increased by 128%. Let me now turn to Dr. Lee Bowes, CEO of America Works.
Thank you. Let me start by quoting one of our placements, Patricia Hines. I'm a 43-year-old mother with 6 children. I've been on public assistance for 17 years. For the past 2 years, I've been employed by Comstock as a data entry clerk, earning $17,000 a year with benefits. This year, I'll be starting college at night. Comstock's president, Henry Scanlon, stated, "This makes sense where other government efforts haven't for me. I have a willingness to get involved as long as it is in the context of what works." I have hired 8 people through America Works, and 2 have even gone on to become managers. America Works makes sure that they don't come in late and have great attitudes. It makes business sense. This is one example of the 12,000 cases where the model has worked for both the welfare recipient and the business. Since our inception in New York, we have expanded in New York City. We've opened offices in 3 counties in Albany and opened an office in Indianapolis, which has tripled in size. Currently, there are developments in Philadelphia, Florida, Georgia, Texas, Chicago, and Maryland. Both sides of the political spectrum have supported it. This past year, America Works entered into an agreement with LISC, the national organization providing support to community development organizations nationwide. We are currently joint venturing with these local nonprofits, in which they'll own 50% of the for-profit venture. One group, WEDCO, located in the South Bronx, is renovating an abandoned hospital to provide low-income housing, and it will include an America Works joint venture. In closing, we have been inundated with media and others' requests regarding our model and welfare reform. To receive your award would not only be a great honor, but we feel would provide valuable public information about a humane business approach to investing in people, and as David Osborne has stated, a great example of reinventing government.
Thank you. Questions from the committee, starting with Jack and Don.
Actually, let me ask two at once. The program has been going, it started in '86, but the contract with America Works went into effect in '88. So in 8 years, you've had 1,600 cases. It doesn't sound like very many, 200 a year. Second question, then I get out of your way.
Okay.
Am I right to recall that there were America Works programs in Ohio and Massachusetts over some period of time? And how do they, what happened to them, and how do they differ from what's going on in New York?
Well, let me speak to the contracts. The amount of people that have passed through America Works is based on two models. One in New York City, where it's a voluntary model, and as you know, under the JOBS program, a lot of that participation was voluntary. In Albany County, though, about a year and a half ago, I believe, it switched to the mandatory approach, where people are actually assigned to that, to America Works. And the numbers have been small, based upon small pilot demonstration programs. We are looking to extend those contracts as they come up towards the end of this year. We'll be looking at this model to replicate, because I'm sure we're going to need it under the new welfare reform program. Speak about it, yeah.
America Works in 1984 opened a company in Ohio, and it was eventually turned over to the local operator. It's called Cleveland Works. It's a nonprofit. They decided they didn't want the risk of the for-profit, and they do training and placement. We've never operated an America Works in Massachusetts.
What's the relationship of your other programs to the one in New York?
Each company is set up as an individual corporation, as a separate subchapter S corporation. Cleveland Works does not have a relationship, except that we started it up.
A yield of 1,600 in that period of time, how many people would have gone through the process, would have started or dropped out in order to get that yield? And what is the difference between those who succeed and those who fail? Are you cherry picking? I mean, I'm trying to get at the success of the program.
There are about, for the 1,600 retained placement, a little under 3,000 people who would have started. And again, as Brian mentioned, in an area like the 3 counties around Albany, where it's mandatory and the retention is higher, over a year later it's 94% are still working, the numbers are less. In New York City, people have been able to pick which program they want to go to, so they could start one program and move to another. Our profile is a long-term welfare recipient. You know, people are with us for a long period of time, 5 years of welfare. Half of them do not have high school degrees.
When I mean retention, I don't mean the number of people you placed in jobs, but the number you started out with.
That's what I'm stating,
Okay.
a little under 3,000.
We have 4 questions. We have 3 questions pending. First Tom, David, and then Barbara.
My question's been answered.
And we have David.
Yeah, just like the direct student loan program, there are
folks out there who are wonderfully enthusiastic about what you're doing. There are others who are critics, and it's very hard sometimes to sort out for us what the critics are saying. Could you respond to 2 points the critics make? One is that America Works is creamy and therefore has better results, and the other is you hear from scholars because the information in America, because it's a company, it treats its information in a proprietary fashion, and scholars cannot evaluate the true success or lack of success in the program in the way they can other public programs. Hey, Dr. Bose, if you could address that, I'd appreciate both those questions.
As far as the creaming issue, that's particularly why in Albany County we have gone to the mandatory assignment, because we were concerned about that. And based on the results we've seen to date, it is actually better in that pilot than it is in the New York City area. So I'm convinced that it is not a creaming act. And given its track record against any of our other contractors, whether they be on the public side, through even our Department of Labor, or through the voluntary not-for-profits, their track record is equally as good, and in many cases, much better. Want to talk about the evaluation group?
There is an evaluation being conducted by Baruch College in New York City, funded by a few different foundations. It's started over a year ago, and it's tracking people, long-term results, comparing the America Works program, the profile of the people, with some of the other organizations, governmental and nonprofit in New York City.
Has MDRC ever conducted one in the same way they had for GAIN earlier today?
No, they haven't. We've talked to Judy Garone about it. It's a matter of who wants to put millions of dollars in to do that kind of study. Right now, there isn't an interest in doing that in the part of the government sector, and because we're for-profit, we haven't really found a foundation willing to put that up. In Indianapolis, Rockefeller Foundation is going to be conducting a long-term study with MDRC, and we're part of that. So again, that's down the line. Originally, back in the 1970s, we were part of a MDRC study when we were a nonprofit.
Last question from Barbara.
I'll try to do this briefly. Your materials indicate that all AFDC people who come are eligible and they can come voluntarily, and you're not cherry picking, they just arrive. But if you've got 148,000 plus recipients, there must be more arriving than you're taking. And so I'm just trying to understand how you select if you get 10,000 people who want to apply and you're only taking a few hundred a year.
Well, first of all, the amount of people is governed by the size of the contract. I mean, it's a set contract amount. That's why I'd say we're renegotiating it. The contract is up in December, and that will be expanded.
I understand that, but your materials say that anybody who comes is eligible, and but you have a limited number that you're serving. So how do you make the distinction?
First come, first serve. So we have anywhere from 6 months to 9 months waiting list for people who want to join the program.
It's not pick and choose off that list.
Thank you.
It's just first come, first serve.
Thank you. Our time is up, and